Routes of entry. Different substances can find their way into the human body in different ways. There are 4 ways that hazardous substances can enter the body, which are: 1. Injection. If a substance can breach the skin, that can be harmful in itself, but injection is also a harmful route of entry for any poisonous substances or dangerous bacteria, which in this situation will inject into the body's system either through a puncture wound or through broken skin, which can include pre-existing cuts and wounds. Examples of how substances can be injected are explosives, sharps, for example, those used in healthcare and found when cleaning public spaces or on tools and equipment, and substances under high pressures. 2. Inhalation. Inhaling a hazardous substance is one of the most common routes to entry and involves breathing in the materials. Examples are vapours, gases, mists, dust particles, mold. 3. Ingestion. Some hazardous substances, in particular bacteria, can make their way into your body through ingestion. Eating and drinking is, of course, a clear route for intake, which can come from poor hygiene, for example, not washing hands before eating and preparing food. 4. Absorption. Hazardous substances can make their way into the body through the skin. In other words, the skin absorbs the substance, and then, in the worst cases, it makes its way into the bloodstream and vital organs. Absorption is usually how you might contract skin diseases like dermatitis. In those situations, the substance sits on the layers of skin and may not necessarily make it into the bloodstream. Not all substances can enter the body in all 4 ways, though. How they make it into the body will depend on the type of substance. For example, dust from flour is not going to be harmful by absorption or ingestion, but is harmful by inhalation.